What is diffusion tensor imaging in brain mapping? Have you ever wondered how scientists visualize the brain's complex wiring? One fascinating method is called diffusion tensor imaging. This advanced form of magnetic resonance imaging captures the movement of water molecules in brain tissues. Unlike traditional magnetic resonance imaging, which provides static images, diffusion tensor imaging reveals the brain's microstructure, especially its white matter. White matter consists of nerve fibers that connect different brain regions, and understanding this connectivity is essential for both research and clinical applications. At the heart of diffusion tensor imaging is a principle known as Brownian motion. This principle states that water molecules move randomly. However, in the brain's white matter, this movement is directionally constrained along the axonal fibers. By measuring how water diffuses in multiple directions, diffusion tensor imaging creates a tensor. This tensor is a mathematical representation that captures both the magnitude and direction of diffusion in each three-dimensional pixel of the brain. The resulting data allows for the generation of images that reflected the orientation and integrity of white matter tracts. One common visualization technique used in diffusion tensor imaging is called tractography. This method reconstructs the three-dimensional pathways of white matter fiber bundles by following the principal diffusion directions. As a result, researchers and clinicians can see how different brain regions are interconnected through these neural pathways. Additionally, diffusion tensor imaging images can be color-coded to representing the direction of fiber tracts, making it easier to interpret complex brain networks. From the perspective of emerging computing technologies, diffusion tensor imaging represents a sophisticated integration of imaging hardware, advanced mathematical modeling, and computational algorithms. The acquisition of diffusion-weighted images requires precise control of magnetic gradients within magnetic resonance imaging scanners. The subsequent tensor calculations and tractography relying on powerful image processing software and computational resources. The practical applications of diffusion tensor imaging in brain mapping are numerous. In clinical settings, it aids in diagnosis and surgical planning. For instance, it helps identify critical white matter tracts, such as the corticospinal tract, which is essential for motor function. Mapping these tracts before brain surgery can minimize damage to important neural pathways. In neurological research, diffusion tensor imaging enables the study of brain connectivity and the effects of neurological diseases. It can detect changes in white matter integrity associated with conditions like stroke, multiple sclerosis, and tumors. Furthermore, researchers use diffusion tensor imaging to observe how white matter evolves across the lifespan, providing insights into normal and abnormal brain maturation. In summary, diffusion tensor imaging is a cutting-edge neuroimaging technique that combines physics, advanced computing, and medical imaging to map the brain's white matter architecture. It plays a vital role in both research and clinical settings by providing detailed information about neural connectivity and tissue health that traditional imaging methods cannot offer.